I do want to spend the last couple of minutes talking a little bit about that last major cellular component of the skin, the melanocyte, which when it is going bad, causes melanoma. The melanocytes, these are these cells at the bottom of the uh, skin, the bottom of the epidermis, alongside the basal cells. They're the ones with this very prominent white halo around them. In general, there's one melanocyte for about every 8 basal cells, but the more sun damage, sometimes we see melanocytic hyperplasia, more and more of them grow, and eventually that turns into a cancerous condition. Melanoma isn't as common as basal and squamous cell cancers, but it's awfully common even on its own. Couple of 100,000 cases in the United States and over 8,000 deaths predicted for the United States this year. And it's really common in states with a lot of sunshine like California, Florida, Texas, and so forth. Melanoma is one of the top 5 of the major forms of cancer. And they don't even show basal and squamous here, because if you added up all the basal and squamous, it'd be more than all of these other ones. But if outside of that, these are the more considered the more major forms of cancer by the American Cancer Society, who keeps these statistics. And melanoma is number 5 in its incidence rate. But fortunately, because we can catch melanoma early like other skin cancers, it is not at the top of the death chart. Only about 1 to 2% of all deaths from cancer are from melanoma, and that is more than the number of deaths from other forms of skin cancer. Slightly more melanoma deaths than all other skin cancers put together. But we've got a problem. The number of non-melanoma skin cancer deaths seems to be going up, while at the very bottom of this chart, the number of melanoma of the skin cancer deaths are going down. Red is bad in this case, and moving that way is bad. Blue and moving the other way in negative direction is good. And you see they are absolutely at the opposite ends of the spectrum. In men, not so much in women. In women, melanoma is still at the bottom, but skin cancer deaths are not going up nearly as much as in men. So men, big problem for both melanoma and non-melanoma, diagnosing it early. And so just a few words on how do we diagnose it early and why do we diagnose it early? It saves lives. It allows much easier treatment. That's true whether it's melanoma or skin cancers of any sort. And here's some examples with melanoma. It's a few years old now. These numbers are even better today. Overall, the 5-year survival for melanoma in this country is well over 90%, but it's nearly 100% if we catch the melanoma in its earlier stages. Whereas it drops if it's gone to the lymph nodes, it drops further if it's spread. Not 100% in either direction, but obviously if we can find it early, that's better. That's where the ABCDs come in. These are specifically for early melanoma diagnosis. A for asymmetry. The lesion isn't the same in all different directions. B is for border irregularity. It looks like a map of Australia or someplace where there's nooks and crannies and so forth, bays and inlets. The color is variable, with black being the most dangerous color. But even as you see at the final one, just different shades of brown is enough for it to be cancerous. and the larger diameter is certainly a concerning factor. We want we are concerned about any mole that is greater than the size of the eraser on the edge of a lead pencil. And this particular melanoma shows a lot of other nasty signs. Ulceration right in the center, that little crater there. That's much worse than the rat bite we saw in the basal cell cancer. It has these satellite nodules, this broad stain of melanoma cells spreading in what we call a radial growth pattern, as well as these satellites. This is a very advanced melanoma and not what we want to see at all. But not all melanomas look like this. The ABCDs don't work for all of the melanomas, but that's another lecture for another day. These are the different types of melanoma that we talk about. The most superficial spreading is the kind of the classic, but they can be nodular. Lentigo maligna melanomas are often large, flat, tan or brown. These are usually in very heavily sun-exposed areas. Acral skin means skin that is not hair-bearing. Where don't you have hair no matter what? On your palms and soles, under your fingernails, on the back of your hands, and on the top of your feet. Most of us don't have hair. That's where we get acral melanomas. And desmoplastic is a particularly rare form of melanoma that occurs in very sun-exposed and sun-damaged skin. So the common denominator for all of these is that the sun is the primary cause of almost every one of these skin cancers that we're showing on this slide or any of the slides that I've shown. And that proves it's never too late, or especially it's never too early, to be sun smart and take care of ourselves and our children. What does taking care of ourselves in the sun mean? Being sun smart, protecting ourselves, staying out of the sun at the peak times of day between 10 and 3 in the summertime, particularly. Slip on a hat, slop on the sunscreen, slap on your shades, seek the shade. All of these are things we should be thinking of. We can still have an enjoyable time, enjoying all the outdoors has to offer, and protect ourselves and our children. Vitamin D, people say, what about vitamin D? Do you want vitamin D? Get it from a pill. You do not need to get it from the sun. And the more sun you get, you don't get more vitamin D. You can get all the vitamin D your body is capable of producing from a 10-minute walk near sunset. And that's only a fraction of what you might get from a vitamin D pill. So be smart, wear sunscreen, stay out of the sun. People always ask me, what's the best sunscreen? I say the best sunscreen is the one you put on, not the one you left on the shelf back at home. There are all different kinds. Again, going through all the details of sunscreens is a lecture in its own self. But if you are paying attention and being careful, only you can prevent sunburn, and you can do an awful lot to protect yourself from the sun. The best approach to skin cancer is to try to avoid it altogether. But if we can't avoid it, we want to diagnose it early and get it taken care of. So thank you for paying attention to this, and thank you for letting me speak a little bit about these different forms of skin cancer.